arm is simply the part of the upper limb that is located between the shoulder joint and elbow joint. There are 4 muscles that are contained in the arm, which are grouped into the muscles of the anterior compartment and the muscle of the posterior compartment. The muscles of the anterior compartment of the arm are the biceps brachii, brachialis muscle, and coracobrachialis muscle. The other muscle that is seen in the posterior compartment of the arm is the triceps brachis. In this video we shall look at the anatomy of the muscles, where they attach, the nerves that supply them, and the various actions they perform. Let's dive right in. Let's first of all look at the muscles of the anterior compartment. Like we said at the beginning of this video, there are 3 muscles in the anterior compartment of the arm, which are the biceps brachii, the brachialis, and the coracobrachialis. These muscles can be remembered with a mnemonic BBC, where the first B stands for biceps brachii, the second B stands for brachialis, and the C stands for coracobrachialis. These muscles are all innervated by the musculocutaneous nerve, and their blood supply is through the muscular branch of the brachial artery. Let's study these muscles one after the other. We go first with the biceps brachii. The biceps brachii is a muscle with 2 heads, a long head and a short head. Despite the fact that almost all the mass of this muscle lies on the humerus, it still doesn't make an attachment with the humerus. As the tendon of the biceps brachii gets into the forearm, it gives off a connective tissue sheet that is called the bicipital aponeurosis. This bicipital aponeurosis forms the roof of the cubital fossa. Not only that, it forms the roof of the cubital fossa. It also blends with the deep fascia of the anterior forearm. The long head of this muscle originates from the supraglenoid tubercle of the scapula, and the short head originates from the coracoid process of the scapula. Both heads insert distally into the radial tuberosity and the fascia of the forearm through the bicipital aponeurosis. The function of this muscle is the stimulation of the forearm. This muscle does not only perform the supination of the forearm, it also flexes the arm at the elbow and at the shoulder. Just as we stated earlier that all the muscles of the anterior compartment of the arm are all supplied by the musculocutaneous nerve, biceps brachii isn't an exemption. It is also supplied by the musculocutaneous nerve. The bicep tendon reflex tests the 6th cervical spinal segment. The coracobrachialis muscle is another muscle of the anterior compartment of the arm that lies deep to the biceps brachii. It originates from the coracoid process of the scapula and then passes through the axilla before it finally attaches at the medial side of the humeral shaft at the level of the deltoid tubercle. The function of this muscle is for flexion of the arm at the shoulder and also weak adduction. We already know that it is innervated by the musculocutaneous nerve. The 3rd muscle of the anterior compartment of the arm is the brachialis muscle. It lies deep to the biceps brachii and is found more distally than the other muscles of the arm. It forms the floor of the cubital fossa. This muscle originates from the medial and lateral surfaces of the shaft of the humerus and inserts into the ulnar tuberosity, just distal to the elbow joint. The function of this nerve is the flexion at the elbow. It is obviously innervated by the musculocutaneous nerve too, with some contributions from the radial nerve. As we have been able to journey through the anterior compartment of the arm, let us tour around the posterior compartment of the arm. We stated earlier that the triceps brachii is the only muscle contained in this compartment of the arm. The reason why the muscle is called triceps brachii is because it has 3 heads, namely the long head, lateral head, and medial head. The medial head lies deeper than the other 2, which cover it. The arterial blood supply to the posterior compartment of the upper arm is through the profunda brachii artery. The 3 heads of this muscle have different origins. The long head originates from the infraglenoid tubercle of the scapula. The lateral head originates from the humerus, specifically superior to the radial groove, while the medial head originates from the humerus, specifically inferior to the radial groove. The heads of this muscle distally converge into one tendon which inserts onto the olecranon of the ulna. The function of this muscle is to perform extension of the arm at the elbow. The nerve supply to this muscle is by the radial nerve. A tap on the triceps tendon tests spinal segment C7. It is important we note that some individuals have their long head of the triceps brachii innervated by the axillary nerve. The arm is not an invincible structure. There might be a condition whereby there is a rupture of the biceps tendon, although a complete rupture of any tendon in the body is rare. However, the long head of the biceps brachii is one of the more common tendons to rupture. This produces a characteristic sign on flexing the elbow, a bulge where the muscle belly is, called the Popeye sign. The patient would not notice much weakness in the upper limb due to the action of the brachialis and supinator muscles. That is it, guys, on the muscles of the arm, and I believe you found this video helpful. Your support Joan Academy by subscribing to this page and sharing this video with your friends. God bless you for your support.